Good evening, everybody, and welcome to our webinar on the New South Wales Urgent Care session. My name is Jenny Pearson. Before we go any further, I'd just like to acknowledge the traditional custodians of the land that we're meeting on today and pay respects to elders past, present and emerging. I'm coming to you from Enewan land in the Northern Tablelands. This session is being recorded and will be uploaded to our website in our education library along with a copy of the slides. If you have any questions, please type them into the question box and we will endeavour to get them all answered for you tonight, time permitting. I think that's all you really need to hear from me, so I'll hand over to our presenter tonight, John Bailey.
Thanks, Jenny, and good evening, everyone. Thanks for joining us tonight. We'd like to provide you with some information on the New South Wales Urgent Care EOI process. And just to let everyone know, any questions that are asked will be answered as soon as we possibly can. If we need to go to the Ministry for more details, then we will do that. I just also want to let you know that if you ask a question, the question and the answer will be published to be transparent for all providers. I'd also like to acknowledge the traditional custodians of the lands on which we're meeting and pay my respects to elders past, present, and extend that respect to other Aboriginal people who may be present tonight. What I also want to do is to clarify for everyone that there are two similar but separate activities currently being discussed and in train. The first one is the Commonwealth Urgent Care Clinics that were announced in the October budget. The second one, and the focus for tonight, are the New South Wales Urgent Care Services that were announced several weeks ago, and the EOI, which is live now. Just to provide some context, the stated objectives of both activities are aligned and almost identical. In April this year, the then aspirant Prime Minister, Anthony Albanese, announced that the intent of the Commonwealth program was to have less pressure on hospitals. Dominic Perrottet, the Premier, on the 30th of August announced that the intent was to have urgent care services reduce the number of people presenting to emergency departments. The purpose of this EOI is to elicit interest from general practice and other service providers who may be willing and able to provide urgent care services, and to assess their capability and readiness to do so. And please note, this is just the beginning of this process. What I'd like to do now is just provide you with a very high-level overview of what New South Wales Health see as an urgent care system, which encompasses the 5 following urgent care service areas: urgent care triage lines, urgent care clinics, rapid response hospital teams, in-hospital teams that is, service delivered in a patient's home or their own current location, and virtual care. All of those are in scope. Just some key points. It's encouraged that there is a collaborative delivery of services by general practice, the PHN and the LHDs wherever possible. There's an opportunity for specific statewide services to be managed by New South Wales Health, where there is identification of a common service across multiple submissions. So at the end of the process, there may be one or more services that have a statewide capability and capacity, and New South Wales Health reserve the right to work with those. In terms of mode of patient access must be specified in the application, noting that walk-ins, that is those walk-ins who attend clinics, cannot be turned away. They must be seen. Services that involve face-to-face appointments should have the technical capability to accept an online booking for an appointment through either a central intake service or via local referral pathways, allowing flexible access. Continuing the key points. Urgent care services have extended hours of operation to be staffed by appropriately trained clinical staff. They need to have access to a network of resources that can streamline referrals to other healthcare providers when and where required. Hours of operation should cover, but are not limited to 8 a.m. to 8 p.m, Monday to Sunday, and include public holidays. Just for noting, any application or EOI that is business hours restricted will not be considered. Patients must not be excluded from urgent care services based on being an existing practice of the patient of the practice alone. This extends both to paediatric and adult patient cohorts, and the service must be willing to accept patients who are not currently part of their practice books or part of their current patient work. Just to go to the issue of funding, the application requires the details of what resources are required to expand or establish the urgent care service. Please note that this is an annual estimate if that is all that is available, and an outline of any services that are already funded by MBS. At this stage, funding estimates will be suitable as we acknowledge, and New South Wales Health acknowledge, that the precise amounts may not yet be available. In the application and on the application form, you are required to provide advice on the billing model to be used by your service, that is fully private, bulk billing, or a mixed billing model. How to apply. The EOI form is available through the link here. These slides will be available to you after this webinar. Download the EOI and the urgent care pack, and this is to be used for general practices and other participating services. The form provides further information around the EOI process and, sorry, I just got interrupted by something. The form provides information around the EOI process and must be completed in full and returned to the PHN at the email address urgentcare@thepHN.com.au by close of business on Friday, 4th December. The application form is editable, and we've been asked, is there a word limit for each of the sections, such as this one here? And the answer is there's no upper word limit. Let me just step you through the process. EOIs must be submitted via your primary health network via this PHM by 5 p.m. on the 2nd of December. Please send your completed submissions and application form to urgentcare@thepHN.com.au, and it must reach us by that deadline. Late submissions won't be accepted. Submissions will then be assessed by the PHN and our 2 LHDs, with the applications being prioritised using data analysis and local intelligence. Only 3 applications per LHD will be prioritised. Then the prioritised applications will be sent through by the PHN to the Ministry of Health by the 9th of December. It is the Ministry's responsibility to consider the EOIs put forward by the PHN and local health districts to become part of a pool of sites interested in delivering urgent care services in New South Wales. In addition to the question panel for tonight's webinar, other questions can be sent through to urgentcare@thepHN.com.au. We'll endeavour to answer them, and if we can't, we will provide you with a response as soon as we can. We've also been made aware that there are some issues with page 13 of the EOI, and we've requested clarification for from the ministry on that. In the meantime, please start your EOI if you intend to submit one, and we'll provide further advice between now and the submission date on how to overcome the issue. Okay, there are a couple of questions that we've had. The first question from Di Pierce is, will the slides be available after this webinar? The answer is yes. And what support is being offered to existing after hours urgent care? What I'd need is a little bit more detail, and I'd encourage the person who posted that to email urgentcare@thepHN.com.au with the details of the circumstances and the type of service they're talking about, and we will be able to provide some further advice. And as I said, that will be published up on the website once we receive a response. Jenny, I think that's it.
Okay, that's what we like, short and sweet. Ellie Warren is here. Ellie, did you want to say anything before we finish up?
Hi guys, can you see me okay?
We can.
Yes, we
Thanks,
can.
Ellie, and thanks for joining us.
No problem. Yeah, I guess just a word from the GP collaboration panel. I'm chair of that group, and it would be nice to see some EOI applications that pool all of our resources across the coast and look at collaborating with each other to make the most of existing services, I guess. We've been talking to a few people about how this might happen, and there are some interesting models being put together. So be creative and reach out to colleagues.
Yeah. Look, absolutely, Ellie. One of the things we would encourage is individual services or groups to reach out, contact their colleagues. If they want us to do some introductions, we're happy to do that. And, you know, collaboration might get your particular proposal across the line, where in isolation it may not. So leverage off those people around you and other services. So Con Mafola has asked, are there going to be restrictions as to how many patients can be seen per day? I guess, Con, that depends on the service and how it's structured, the staffing and the resources. It's really about the capacity and the capability of the service and the model that's put forward. In some cases, there may be some physical restrictions that cap that out, but for other services that may not be the case, in which case it's really only the capacity of the service that would be a restriction.
I have a question, John, just that some other GP colleagues have been asking. I'm not sure whether you're aware, but if maybe we can take it higher if it's not clear, but will the urgent care centres fulfil the criteria for the PIP after hours incentive measures? Incentive payment?
That's a good question. Can I take that on notice, and we'll certainly have a look at that. In some circumstances, plainly they will, but in others they may not, particularly some of the more micro details of PIP requirements. So let me take that on board, and we'll try and do some homework and provide an answer to that. One of the things that one of my staff wanted to remind you of is we can facilitate introductions between services who might want to collaborate. We can facilitate those. So if you drop us an email and let us know that you'd like to collaborate with a particular service or in a particular service model, then we'll try and do some introductions as well. All right, Ellie, there's a question there. Oh, it's Andrew Sargent wants to talk to you about something else. Oh no, it's around, CXDX connected diagnostics. Andrew, we're happy to try and answer questions and have a chat. I'm more than happy to give you a call, and I'll put my, I'll give you my contact details. So my contact details are via the urgent care at thepHN.com.au, or my mobile number is 043 9944 123. So that's 043 9944 123. So the question from Louise Fisher is, if we're submitting EOIs across multiple PHNs, should we submit one joint EOI or an EOI to each PHN? Louise, that's a really good question, and I think you would increase your chances if you were submitting them at multiple points, but it'd be useful in the text to indicate that that's your intent, because it may be that the PHNs then can work up some collaboration. So absolutely, if you're looking to put in the same EOI across multiple PHNs, please do that, but also let us know so we can try and join the dots. Any other questions? Can I also strongly encourage you to have a think about how you might work with specific cultural groups and our First Nations people. It's important that you have a look at the opportunity to work with AMSs and others in that space. So I just encourage you to think a little bit laterally about what it is you're proposing, and try to collaborate with as many people as you can. The more you collaborate with, the more success you're likely to have.
John, would it be useful to describe, before we finish, some of the models that have worked elsewhere, part of the NOUS group findings? What are successful models that are working
I'd love to, but I actually don't have those with me. So but look, what we do know is that models where the service takes off the LHD those more acute presentations, but not triage category 3s, sorry, 1s, 2 and 3. So it's really around those things that require a higher level of management, but not necessarily an emergency department. There are models where collaboration with local emergency departments has been successful, and I encourage you to have a look at it. And I'm more than happy to put up on the on our website some of the material that we have found in terms of background for reading, etc.
That would be really useful, I think, for GPs and people applying to have a look at that and make sure, you know, we align with the best evidence for what's working well elsewhere. Seems to be those that are co-located with imaging and pathology are really successful as well, plus
Absolutely.
or minus allied health and other members of the team.
Absolutely, and I think those that have been successful and those that work well have had the diagnostics close to hand, but many of them have also used alternate workforce and other workforce, including physios. So if you think about some of the limb fractures, etc., then they can be quite effectively managed with physio input. Keith Drinkwaters asked the question, you mentioned bulk billing, mixed billing, etc. This seems to be at odds with how the original documentation on these clinics, or am I confused with the Commonwealth programs? Keith, the Commonwealth have been very explicit in saying that the Commonwealth clinics, once they're established, must be bulk billed, must be bulk billing. This EOI asks you to nominate that model as part of the EOI. So you're right, there are two separate programs with different ways of looking at the issue of billing. It's explicitly asked in this EOI which model you have, and you can tick more than one. And also in the Commonwealth, it's very explicitly said that it will be bulk billing. Hope that answers the question. And Andrew, yes, I'll give you a call. I've got your number now. I'll stalk you. Just one final, I mentioned First Nations and cultural groups, but also one of my staff has asked if we can also highlight other vulnerable groups, including those with a disability. So it'd be worthwhile having a look at the opportunity to support other members of our community, those that are disadvantaged in particular.
John, would it be useful for me to just highlight some of the wish list that the GP panel came up with when it comes to GP-led urgent care clinics, just quickly?
Yeah, sure. I might just answer Linda Brown's question. Can a practice apply for both the state and the Commonwealth funded programs? Absolutely. Yep. Go, Ellie, you're on.
Oh, thanks, John. We've been talking about what would be our ideal GP-led urgent care clinic here on the Central Coast, and that can be adaptable in other regions across the PHN footprint. But in some discussions with LHD about co-locating near the emergency department or near where the existing after-hours services are located. And then, yeah, as we've mentioned already, the use of imaging and pathology on site or close by would be ideal. And if we can collaborate with, even with LHD, nursing, allied health and admin could be very useful and a way to share responsibility, targeting triage category 4s and 5s in a safe and secure location with good access for patients. And parking comes up as a really important factor when it comes to these clinics, the availability of good accessible parking and safety for both workers and patients. I guess we've got to think about IT and equipment as well, whether we're going to use best practice and medical software or other software and the booking and appointment systems. And then thinking about how you're going to pay the GPs comes into it as well. So they were the main points highlighted by the GP collaboration panel as thought to be important in this sort of model.
Absolutely. Good observations. Particularly those around safety and security, noting that the services are expected to operate at least up to 8 p.m. So Con's asked the question if GPs are showing enthusiasm or what. Ellie, my hospital pass, no pun intended, that to you.
I think the elephant in the room is workforce and the concerns around diluting an already overstretched GP workforce. So that's where collaborating really comes into play and sharing our resources across the area and coming together as a team, not necessarily just as one practice, but sharing our collective. So yes, enthusiastic and remains to be seen whether workforce can live up to the enthusiasm.
I guess with the range of service models that I described early in the presentation, there's an opportunity to look at services that are physical and virtual, that use a dispersed workforce, that use different categories of workforce. So I think there are ways in which the current issues around workforce can at least be lessened, if not eliminated. And note that they are problematic right across our region. A question from Tamina, will this type of session be done again? No, we won't be doing this one again. We've got a really tight window through to the 2nd of December. We will be putting this recording up on our website as soon as my team can do that. So there are 2 ways in which you can follow up. The first one is to share the link with your colleagues to this webinar. And secondly, use the email address that's on the screen now to put your questions or other comments through to us so that we can hopefully be able to answer those for you. I think we're probably run out of steam, Ellie. So I'm going to say thank you very much, Ellie, for joining us. I know you've got a busy life, and appreciate your time and your input. And thanks everyone for joining us. We really appreciate your interest, and I look forward to setting a bit of a challenge, which is to sift through many EOIs. So thank you.
Thanks,
and thanks, Jenny. Sorry.
You're right. Thanks, John. Ellie, thank you so much for giving up your time this evening. I will get this uploaded to our education library on the website ASAP. There will be a very quick evaluation that'll pop up at the end. We would love to get your feedback. It'll only take you a minute to fill in, I promise. Thanks, everybody. And I think this is our last webinar for the year, for me anyway. So all have a Merry Christmas, and I hope you all get a bit of a break. Thanks so much.
Might be for you, Jenny. I can assure you it's not my last one. Thanks everyone.
Bye.